So, hi, it's Derek here. I'm just going to go run through a few little things. I'm just going to run through things like writing pathology or radiology or gastroenterology referrals, etc., etc., etc. So, in terms of pathology, if you could go up to the very top to the toolbar, you can see the little test tube. So if you click on that test tube, it'll call up a dialog box that includes, the pathology requests that you can add to. So the normal pathology lab that we use is one called Western Diagnostics, but to be honest, it doesn't really matter um, which lab you put in here because all the forms are very, very similar. Um, if you go to this box here, what you could do is you could just put in whatever test you want into that box, and then put in whatever clinical details you want into this box without using a lot of these details here, which I don't find especially useful. So let's say this person has come in and you just diagnose them as being pregnant. You might want to do the antenatal blood tests. So you could do things like full blood picture, varicella, syphilis, HIV, hepatitis, serology, rubella, etc., etc., etc. And then you could put 6 weeks amenorrhea, and then press print and just make sure that the appropriate request stationery is in the printer in the correct slot. Okay, and now you just saw that that was pretty cumbersome. So, what I like to do is I like to just make sure that we set up some of the favorites, and lots of people set up favorites which are very short. But what I find is that if you click on the setup favorites, and you add things that are long, then I find it's much more usable. So I've got one of the favorites which is all the which is all those antenatal blood tests and etc. etc. I've got one for respiratory serology, one for respiratory PCR tests, um, etc. So you can certainly get creative with it, and add a lot of tests all together, so that it's a lot more straightforward to write that pathology request form. So that's pathology. For radiology for the same patient, what you could do, what you do is you get this little chest X-ray and you click on it, and you can write your referral form for this. So you might have something like a barium meal, and then add some sort of, history on that. So question mark gourd, and then press print. So that's very straightforward. Again, all the stationery looks pretty similar, so it doesn't really matter what you put in here. You don't have to use the drop down list here in order to find or in order to fill out the form. So that's for radiology, and that's pretty straightforward too. I normally just hand that to the patient and ask the patient to book an appointment for that. In terms of gastroenterology and cardiology type tests, Joondalup is a little bit of an unusual area where a lot of public hospital type tests wind up being done through private offices. So we just normally write a letter to a cardiology company or a gastroenterologist in order for them to do that test. So a special template's been created for that. If you go to the letter writer, so click on that, and then add, and then write a new letter, One of the referrals is a referral test, a referral for investigation. And if you could just click on that, you can choose the ones for gastro procedures or cardiology if you'd like, but I just tend to use this one. And double click on there, and then choose one of the cardiology companies or respiratory or gastroenterology companies. So let's just choose cardiology. And you might want to just choose, say, someone like Heart Care or Western Cardiology. I'll choose Western Cardiology for this one, and then it'll come up with a drop-down list of the different tests. So you might want to refer this person off for an exercise stress echo, and fill this out, and fill that out. And then it'll just come up with a referral form which you can print off or send by HealthLink as you see fit. Similar procedures followed for gastroenterology, so for scopes, or alternatively for respiratory type investigations like sleep apnea testing. So we can certainly discuss that a bit later on if you want. So that's how to write a referral for testing.